Hi, my name is Dr. Brittney Sprouse, and I am the Director of Audiology at the University of Chicago Medicine. Today, I'm going to present a case study in our pediatric grand rounds titled The Road to Cochlear Implantation. I have no disclosures, and these are the learning objectives for the course today. The case I'm going to talk to you about is centered around one child's road to cochlear implantation, which can look very different for each patient and may not always be as straightforward as we'd like, especially if you're looking at the path running through the center of the image. But before we go into that juncture, let's first talk about how we arrived here. Parent gave permission to provide pictures, name, history, and things like that we'll be talking about during today's presentation. Jay was born full term without complications, passed his newborn hearing screening, has a history of chronic ear infections, multiple sets of tubes, and there's no family history of hearing loss. In April of 2011, at the age of 3, Jay presented to an outside facility for symptoms of new onset limp where he was favoring the right leg. He was discharged as having inflammation in his hip joint, which was causing him to limp. 3 days later, he presented to our ER for worsening symptoms, along with the abnormal gait he presented with, swelling, tenderness at the right temporal para-orbital area. He was immediately admitted and worked up, which did include imaging. Jay was found to have a right retroorbital compartment, right lateral muscle, right globe, and right anterior temporal lobe mass, as you can see on the slide here. This large right-sided mass measured 39 millimeters by 42 millimeters in size. And while he was admitted, Jay started complaining of increased headaches, and therefore additional imaging was recommended. At this time, the workup revealed that he had a large left-sided abdominal mass. Chest, abdomen, and pelvis CT demonstrated this large mass, which was encasing the left renal area, displacing other great vessels to the right, and the mass did cross the midline. It measured 8.3 centimeters by 8.1 centimeters by 9.9 centimeters. So it was crossing to the right of his spine. Jay was ultimately diagnosed with neuroblastoma, which is a form of cancer that develops from immature nerve cells, often originating in the adrenal glands. It affects about 7% of children with cancer, is the second most common solid tumor in children, and most common in children under the age of 5. And as I mentioned, he was 3 when this began. With all of his additional imaging testing procedures that were conducted, he was diagnosed with stage 4 high-risk neuroblastoma. His bone scans demonstrated that his disease had metastasized. It included the right number 6 rib, both femurs, both tibias. The bone marrow assessment showed many clusters of neuroblastoma in 2 of the biopsy specimens that were taken. The orbital mass was displacing the right globe to a certain extent, causing an orbital extension, which was contributing to the headaches that he was experiencing that started quite rapidly after he was initially admitted. Standard treatment for high-risk neuroblastoma includes the use of very high doses of chemotherapy, followed by stem cell transplant, and then typically surgery, so a resection of the tumors. It is estimated that as many as 50 to 60% of children with high-risk neuroblastoma will eventually suffer a relapse. That's a 40% chance of survival with current therapy. If neuroblastoma is going to relapse at all, it usually does so within the first 2 years after the end of treatment. The 5-year survival rate for children with low-risk neuroblastoma is higher than 59%. Jay went on to complete 5 cycles of chemotherapy, which did include cisplatin. He underwent a tumor resection before completing his 6th cycle post-surgery. A month later, his stem cell transplant was initiated. 2 months post-chemotherapy, he completed skull-based radiation. And 3 months post-chemotherapy, he completed radiation to the left adrenal gland. So he was admitted for quite some time. Jay was late diagnosed due to his complex medical history, as his intervention was delayed due to his chemotherapy and radiation. He was ultimately diagnosed with a bilateral high-frequency sensorineural hearing loss while undergoing radiation and fit with amplification post-radiation. So there was some delay, as I mentioned, before he was seen in audiology due to how rapidly his cancer was progressing, the new symptoms he was developing in real time, and just the course of his treatment and care. It's important for us to think about the kind of clinical implications that exist when working with a child undergoing cancer treatment. Making sure the patient doesn't fall through the cracks with referrals while they're undergoing treatment or while they're on the road to recovery. It's important to partner with the patient's interdisciplinary team, and that's both inpatient and on the outpatient side. And we have to be strategic and creative with our device intervention and management, deciding when to intervene, at what points to intervene, and is it a case where we have to intervene multiple times before we're able to move forward with some sort of treatment and management. And I would say for this patient, for Jay, all of this was impacted for him because of his complex medical care. In the summer of 2012, all of his treatment was completed. He had repeat imaging completed, and there was no evidence of disease. Shortly after, he was granted his Make-A-Wish, and the family took Jay on an amazing vacation to Disney World, one that Jay, as well as his family, talk about even to this day. Shortly after his trip, he started having headaches. He returned to clinic and was immediately scanned. They found a posterior fossa mass. And here's a picture of Jay at 4.5 years of age. They were starting the process all over again. It was going to be another uphill battle for Jay and his family. And as I previously mentioned, the recurrence of neuroblastoma typically happens within the first 2 years after the initial onset. His was essentially immediately after treatment. He was able to take his Make-A-Wish trip, and then they were starting on this path again. Jay would go on to spend the next 2 years undergoing multiple visits, procedures, scans every 3 to 6 months post-treatment. At this point, he continued to wear his hearing aids daily. However, there was limited audiologic follow-up due to the family wanting to be as far away from the hospital anytime that they could. They had so much time where he was admitted and they were tied to treatments and follow-ups, inpatient, outpatient. And so one of the areas of his care, and it happened to be audiology, the family did have limited follow-up. He presented back into audiology in July of 2015 for testing, and then returned again in October of 2015. And at this point, he was 7 years of age, 2 years post-treatment, still a consistent device user. At this time, he was using Phonak Sky VTEs. And he had been enrolled in a DHH program in Chicago Public Schools. Here's Jay's hearing loss. He demonstrated poor aided benefit in the left ear and poor mid to high frequency access in the right ear. You can see his SRTs, word recognition scores, right ear 50%, 56%, left ear 36%. So what were the next steps for Jay? Jay was referred for a cochlear implant evaluation. He obtained an updated speech and language evaluation. He had updated workup with his oncology team, which included imaging, and he was cleared for an elective surgery. At this time, our team made the decision to recommend a cochlear implant for Jay's left ear. Shortly after, Jay was scheduled for a left cochlear implant, but he received a right cochlear implant on that date. What happened? During surgery, Jay was found to have a cholesteatoma on the left, and while in the OR, the surgical team made the decision to implant the right ear, as both ears were deemed CI candidates, and patient's left ear would now require further investigation due to the cholesteatoma. Jay was activated in late November of 2015. Hearing preservation occurred for the right ear following CI surgery, which you can see here on the slide. And Jay had consistent performance with his device following implant surgery. The previous aided benefit was around 56%, and he was now up to 80% with his cochlear implant. And this was 6 months post CI surgery. Jay's left ear continued to be monitored regularly by ENT due to the cholesteatoma, and he underwent multiple middle ear exploratory surgeries. Per ENT, Jay would not be eligible for a left CI until he reached about 6 to 12 months of being clear in that ear. And while he was a consistent device user on the right with his CI, he was an inconsistent device user on the left with his hearing aid due to his middle ear status. He still remained in a DHH program at school and was still utilizing the Phonak Sky VTE. Four months later, Jay began complaining again of headaches. He was scheduled for another round of imaging, and the artifact was a concern for oncology. As you recall, the shadow comes in close proximity to the original site of his tumor, which you can see on the slide here. It was determined that there was no evidence of disease, no tumor was present, and he was recommended to return for repeat scans in oncology in 3 months. However, before that could be completed, his parent called audiology requesting an urgent appointment. Jay was reporting that his CI just stopped working. You can see an X-ray that shows his device in place, and testing revealed that it was in fact a right cochlear implant device failure. He was then scheduled for an explant reimplant, and this was scheduled in stages. So as we talked about on the previous slide, where there was some artifact present with his imaging, the decision was made that if he was undergoing an explant reimplant, that there would be some time between those two procedures so that imaging could be completed, free of having an internal cochlear implant device in place. So this allowed time for repeat scans with oncology without that device in place. Originally, the family had wanted an advanced bionics device. However, they had chosen Medell for the MRI compatibility at that time due to his history of cancer and need for serial MRIs. At this time, the family made the decision to proceed with a reimplantation, but using an advanced bionics high-res ultra device. And the parent was very happy to get AB, as that was their original manufacturer that they had wanted to go with. This is Jay's aided testing post-right explant reimplant, achieving 80% at that 3 months post mark. So around 4 weeks, he was at 64%. 3 months later, he was up to 80% for his word discrimination.
It's coming on. Him and his monkey. Hey, you on? Are you on? Yeah. You can hear, baby? Hey, Victoria. Can you hear us? How you doing? How's it sound? Sounds good. Does it sound different than the other one? Yeah, it should. It's totally different. Do you like it? Do you understand what I'm saying? Do you know that? You're supposed to say thank you. All I have to do is just turn it on. You're like, love it, yes. Thanks, bye, see you later. Oh, it sounds good. Do you want it to be louder or softer or fine? Fine.
In April of 2018, Jay was finally cleared to get a left cochlear implant.
You happy? Loud. It's coming on. We have some kids that wasn't for the top medium loud and larger top, so you got some time.
So this was essentially, some of these pictures were taken a month post left ear and about a year from the right ear being reimplanted. In January of 2019, at this point, Jay is 10 years old. He's a bilateral cochlear implant user, remains in his DHH program, and is in 5th grade. His right ear aided speech scores around 88%, in the left ear 76%, and sentences and noise, he's around 72%. And it does go against audiology, but typically he would wear his blue processor on the right and his red processor on the left.
Ready? Hey. Ready? Sit.
And he can be so quiet sometimes in the booth. And while he does do really well with his cochlear implants, he does break down at this time. He was breaking down a lot when there was a harder task, such as speech and noise, especially if we were testing individual ear. He oftentimes wouldn't want to take a guess, even if he did hear the sentence, even if he heard it correctly, things like that. So you can hear just how quiet he is when trying to do testing. So let's fast forward a few years. Jay was seen in the winter of 2022, still a bilateral CI user, remaining in his DHH program, finishing up 8th grade. He's in remission. There's no evidence of disease. Doing well performance-wise. For example, on the right side, aided speech scores are above 92% for both sentences and words, quiet and in noise, and again, a consistent device user. And where are we today? He's a freshman in high school and continues to be a bilateral device user. In September, Jay's mom calls to request an urgent appointment, stating that Jay is asking for increased repetitions. He's reporting that his devices don't sound the same. We scheduled Jay for an immediate appointment, and we're conducting testing. And what we're able to find, so after a few years of Jay having his implant on the left and reimplant on the right, we were notified that his internal devices were on the list of the company's voluntary field corrective action implant list, meaning we were already monitoring his performance closely over the last 2.5 years. When Jay was seen, changes were noted as in his impedances, a significant decrease on high frequency electrodes. There were open electrodes, poor loudness growth, a decrease in performance, including dropping from 97% to below 60%, and changes on objective neural response measures that were previously present and normal. Additional testing and measures were also completed and again indicated his devices were impacted. Jay was scheduled for a follow-up in ENT to determine next steps. At that point, family was determining if they wanted to proceed with another surgery due to his complex medical history, his parent, and the number of surgeries that he's undergone between his cancer treatment, his cholesteatomas, his cochlear implants, his radio revision. His mom was very hesitant to discuss reimplantation. However, patient was seen for follow-up appointments, did meet with his ENT, and they have made the decision to move forward with a bilateral revision. I can say today, the patient underwent his bilateral revision and currently is awaiting reactivation of his devices. Although there were many additional twists and turns that arose from this patient following the recommendation of a cochlear implant, Jay is cancer-free and looking forward to his reactivation of his bilateral cochlear implants. And here's another picture of Jay. Thank you so much for your time today. If you have any questions, my contact information is listed there.